Hello, my name is Dr. Michael Johns, and I'm an ear, nose, and throat physician, also known as an otolaryngologist, and I'm on the faculty of the University of Southern California. My colleagues and I have partnered with Casa Colina to provide ear, nose, and throat care to the community in the region. This video is part of a series of short primers on common ear, nose, and throat problems. Today we're going to be talking about hoarseness. And so a primer on hoarseness. To understand hoarseness, it's important to understand how healthy, normal voice works. And so I thought I'd start briefly with an overview of that. And so in this schematic, we have a person here, and this image is showing their lungs, the windpipe, the larynx, or also known as the voice box, which contains two structures called the vocal folds, or commonly known as the vocal cords. And then it also shows the throat, nose, sinuses, and mouth. And these components all work together to generate the sounds that we make in our everyday communication. When we think about the lungs, we can think about them as the power source. This is where the power for our voice comes from. It's kind of like a bellows. As we exhale, an airstream is formed, and it goes up the windpipe or trachea and passes through the voice box, which contains the vocal cords. The vocal cords we can kind of think of as a mouthpiece on an instrument. As air passes through them, they vibrate and they generate a buzzing sound. And then all the structures above the vocal cords can be thought of as kind of like the horn on the instrument, if you will. And it filters the sound, and that's what generates the voice that we all identify as our own. Now let's get into the voice box a little bit in more detail. So the voice box, also known as the larynx, lives right here in the neck. And there is a cartilage that protects the vocal cords, and deep to that, there are two. And as we magnify them and get a little bit larger, there is this very interesting and complex anatomy that allows the vocal cords to vibrate. And so here is a picture of the human vocal cords, and there is a layer that is protective and covers the soft tissue. There's a layer that's deeper to that we call the lamina propria, that is very soft and gelatinous, and it lives on top of a stiffer layer of tissue called the vocal ligament. And there's a muscle that is deep to that forms the body of the vocal folds. And what happens is this tissue is very, very soft compared to this tissue, which is a little bit more firm, and it allows the vocal fold tissue to vibrate in a regular kind of way and create this buzzing sound that we make. And this is what it looks like in a video that we can see the vocal cords from above. And so this is what healthy resonant voice production looks like. You see the vocal folds vibrating in a regular kind of way. This image shows how we can change the posture of our vocal cords to generate a different type of sound. This is a more pressed quality to the sound. Pressed much more firmly together. Here's a breathy sound. If we're making a breathy sound, the vocal cords don't touch nearly as much, or not at all. So they still vibrate, but they're not completely touching. And this last video example of normal voice production shows pitch change. The vocal cords here are starting very, very taut and tense to create a high-pitched sound, and then they get shorter as the pitch comes down. Take a look at this. But in each of these videos, the vocal cords are healthy, they're vibrating in a regular kind of way, and normal voice is produced with different characteristics depending on how we shape our instrument. Which then leads us to the question, what causes hoarseness? Well, hoarseness, voice change, is caused by anything that disrupts that very regular vocal cord vibration, and it can be a variety of things. It's important to know that hoarseness is most commonly painless, and so the change in voice is sometimes the only symptom. Another thing that's important to know is because there's no pain, when you start having problems with your vocal cords, people commonly can speak louder or push harder and generate the sound that they need to communicate, which can actually cause more and more tissue damage. Much like running, when we run and we run too far, we start having pain in our knees and we get that feedback that tells us, okay, an injury is happening, let's stop. Well, that doesn't happen with voice and voice production, so it can be a little tricky in that regard. The things that cause hoarseness can vary from very, very benign conditions to very, very serious conditions, and I want to walk through just a couple of examples just for education. One of the most common causes of voice change or hoarseness is acute laryngitis, and that's what's shown right over here. This is when you get an infection, most commonly a viral infection, and the tissues swell where the infection is located. And when it involves the voice box, the vocal cords swell and they become very stiff because they're full of fluid. And they can't vibrate, like in this image that you're seeing here on the left. And the vocal cords can't meet and they can't vibrate because they're very, very stiff. And voice comes out breathy and rough. This example here shows a vocal cord hemorrhage, and this is a vocal accident. Oftentimes from a very intense short vocalization like a scream or a yell, the delicate blood vessels on the vocal cords can rupture and one or both vocal cords can fill with blood and you have a sudden change of voice. When the vocal cord gets full of blood, it does not vibrate particularly. Intense voice use over time can cause benign damage to the vocal cords. This demonstrates a vocal cord polyp here on the left vocal cord. Similar to vocal cord nodules or vocal cord polyps or cysts, these are benign lesions that are caused by voice use, and they lead to irregular vocal cord vibration and voice change.
Hold it out.
On the right side of the screen, which is the left side of the body, and you can imagine how having this between your vocal cords is going to create a very, very rough voice. This image here shows what's called a vocal cord paralysis. Sometimes a vocal cord can become immobile. Look at this image over here on the left side, right side of the screen.
How about if you just hold it? Good breath. Deep breath again.
But the one on the left, right side of the screen, doesn't move at all. It stays put.
And then as loud as you can. Good breath and.
Screen, right side of the body.
Good. Low to
Vocal
high.
cords can't meet. Sound becomes very breathy. You have a hard time being heard.
And high to low.
Similar phenomenon as we lose strength
Just
and
comfortable.
muscle mass with aging. Sometimes the vocal cords don't meet and vibrate as well, and we have voice change related to that.
Big breath. Can you give me a high pitch?
Now, the last video shows a vocal cord cancer, and this is really important because this is a painless situation where there is a growth on the vocal cord. And this presents as hoarseness as well. And this is a life-threatening. So all these conditions have in common voice change and hoarseness, commonly the only symptom. And oftentimes it's painless without a lot of feedback to us that there's a problem except for the change in voice. And so voice change that lasts longer than 2 weeks needs to be evaluated by an ear, nose, and throat doctor so we can look at the vocal cords and make sure they're healthy, find out what's going on, because we have great treatment for all of these conditions. Now, if you become hoarse, what do you do? So if you notice change in your voice, the first thing to do is rest the voice. Until we find out what's going on, it's best to give your vocal cords a break, reduce any unnecessary voice use, stay hydrated, rest, and monitor. And if the hoarseness doesn't resolve within 2 weeks, we should take a look. And now you shouldn't be worried or intimidated about having your vocal cords looked at, because it's quite straightforward. So here's a picture from a minute or two ago of myself getting a scope through the mouth. It's very painless, and this scope is like a periscope, and it can look down, and this is how those pictures were taken in the videos that I showed you. Another way that we can look at the vocal cords is with a very, very skinny tube. It's like a little flexible noodle that we can pass through the nose with numbing medicine in the nose with a camera on the end of this, and that allows us to see the vocal cords that way. They're both done in the office without any sedation, and they're painless and safe procedures that we can do. And this is what gives us the diagnosis. So, just to close with some tips for a healthy voice. So important things to do: drink plenty of non-caffeinated, non-alcoholic beverages. This keeps us hydrated. Our hydrated, healthy mucus is the oil in our engine that keeps the parts moving in a healthy kind of way. Keep an eye out on how much talking and voice use you do during the day. Give yourself plenty of voice breaks so you don't overdo it. Breathe when you're talking. Don't forget that the air powers our voice. When you're speaking to large audiences, use amplification so you don't have to scream and holler. And then in general, stay healthy, because our voice will track our overall vitality. Keep an eye out for very loud talking, yelling, screaming, cheering, because they can cause vocal injury if you're not too careful. Talking in crowded or noisy environments is considered a bit of a danger zone, because we tend to raise our voices in noisy situations. And then watch out for unnecessary coughing or throat clearing, because that can be irritating to the throat as well. Avoid smoking. Keep yourself hydrated. And if you're experiencing voice change or throat problems or any ear, nose, and throat problem, we'd be happy to see you at Casa Colina. Thank you so much for tuning into this video, and I hope you found it helpful. If you're interested in an appointment for any ear, nose, and throat problems at Casa Colina, give us a call. The phone numbers are listed right here: 909-596-7733, extension 3800. Stay tuned for more videos, and take care.